My first job was in a mining town, so it was a really young population, really transient population as well. And then the second place I worked in, it was here in Toowoomba. It was a lot of older people that, I'd never really had the chronic disease experience with older populations. And then when I finished there, I thought, what else have I not done? What other part of medicine do I need to see? And I knew Kabul was recruiting just like everyone else was. And I thought this would be a really interesting part of medicine to see. I was really apprehensive because everyone seemed to have an opinion on what working in an Aboriginal medical service would be like. And a lot of people had warnings for me. Some people who worked in AMSs before were giving me some warnings, and so I came into it quite apprehensively. But it was really no different to any other job that I'd had. I mean, the processes were pretty much the same. The expectations of the clients were pretty much the same as well. But I think what I noticed was the amount of support that we had, the amount of programs, the amount of pathways that we could send patients to was amazing. And actually, it's something you can really sink your teeth into. It's really exciting to have the ability to coordinate care for someone in such a complete way. When we work in mainstream medicine, we say, oh, you should go and see a podiatrist or a dietitian, or you should go and do this, see a psychologist. And the patient's kind of left to organise that and coordinate that for themselves. But here we can really get in and coordinate a lot of care for people, which was really good. That was the main difference that I noticed. There's a lot of standout patients in Aboriginal health. There's the amount of patients that have got significant comorbidities is pretty incredible. So, and also there's been maybe not great care in the past, or they haven't accessed healthcare. So you'll see advanced pathology as well. And, you can start to chip away at everything. You can't do everything at once, even though you feel like you want to. But to see someone's HbA1c drop down, 3 or 4%, which is a huge, I never saw that in mainstream medicine, or, see them losing weight or just achieving really good health outcomes because of what you've done, that stands out a lot to me. So no, there's not one, there's a lot. Personally, I think it's mainly been the slight slant to the pathology that I'm seeing, which is, chronic kidney disease that's really significant in a really young population. Previously, my mind had not even been there. So adjusting to the clinical presentations and, the prevalence of certain conditions, that's probably been the hardest for me. Communication has been incredibly easy. It's really easy to sit down and say, so where are you from? Rather than what do you do? Or, say, can I call you uncle? And then you've made a really great relationship with the patient. I find communication and relating to patients is a lot easier in an AMS, but the clinical presentations can sometimes be a bit tricky. The huge team that's around actually is really great. Like, I've never worked anywhere else where I could get an Aboriginal health worker to be present in the room with me if I've got a patient who's going through acute grief. Or I can say, look, this person needs an antipsychotic injection, but they don't have any money. Can we organise that? And someone can run to the pharmacy, and there's just so much support and there's so much care that makes it really interesting and rewarding. We can feel like sometimes we're just a doctor in a room in a box with one person, and not part of a team. But in an AMS, you really do feel like there's a big team that can support you, and you can actually make some really big differences by utilising the team. So that's been novel and really fun. I don't think you should hesitate. I think it's a really great job to work in. It's been my most favourite experience in medicine, really. Even talking through our intern years and times in hospital and other clinics that I've worked at, nothing has been as enjoyable as this. So yeah, I look forward to coming to work, which I haven't really been able to say up till this point.